Now the next thing that we will be studying is about the hypersensitivity reaction. And I have told you, when we will be discussing about the hypersensitivity reaction, they are of 4 types. What are the 4 types you have? Type 1, type 2, type 3 and type 4. What are the names given? For type 1, you have the anaphylactic hypersensitivity. Remember, the letter A is the first alphabet. So the first one is your anaphylactic hypersensitivity. Second you have is the antibody-mediated cytotoxic hypersensitivity. Antibody-mediated cytotoxic hypersensitivity. Third, you have the immune complex mediated. Third one is called as the immune complex mediated. And the fourth one is called as the cell mediated or the delayed type. Fourth one is called as the cell mediated or the delayed type. Okay. So, this is all about the basic thing, right? And you also have a mnemonic for that. Remember, there is one mnemonic, okay? And the mnemonic is acid. To remember the types, right? Like type 1 is anaphylactic. Type 2 is cytotoxic. Type 3 is immune complex. And type 4 is the delayed type. So, this is the mnemonic that you need to remember, the mnemonic of acid, to remember what are the types of hypersensitivity reactions you have, okay? Now, let's move on to the types one by one. First we have is the type 1. Type 1 is basically involved in the IgE antibodies. And I have told you, IgE is related to your allergies, okay? So, it involves the IgE antibodies. First, there is an initial exposure, then there is sensitization, after which the plasma cells get activated and binds to the mast cells and basophils. And when the term mast cell comes, what you have to remember? You have to remember a term called as the histamine. Okay, this is basically the mechanism. I will explain you the mechanism with the help of a diagram as well. Just wait for some times, okay? Then, when there is a re-exposure, the antigen crosses the IgE, okay? And what happens is, there is the mast cell degranulation. There is degranulation of the mast cells that will occur. And if there is a degranulation of the mast cells, as a result of which the mast cell will release what? They will release the histamine, okay? They will release the histamine. Now, I have a diagram for you. Look at this diagram. What is happening here? First, there is exposure to the antigens. You have the allergens like the pollens. Okay, so the pollens, they come to the body. There is mucosal lining all over the body that is present, right? So, the mucosa basically is a protective layer which protects you from the foreign microorganisms, right? So, there is the pollen, it enters. Now, what will happen? There is activation of the T helper cell. There is activation of the T helper cell and the IgE. In IgE, there is class switching which is happening. Now, what will happen? This antigen, this allergen will bind to the B cells. And what will happen? IgE will secrete the B cells. There will be IgE secreting B cells that will be there, which will help in the production of the IgE, as a result of which they will form the mast cell. And now what will happen? The mast cells will release the histamine. Okay. And when there is a repeat exposure, there is activation of the mast cells that will be there. When there will be a re-exposure, there will be activation of the mast cell that will be there. And as a result of which, the mediators that are there will get activated and the vasoactive amines and the cytokines will come into the play. What they will do? The vasoactive amines will mediate the process of hypersensitivity reaction and the cytokines will do the late phase reaction. Okay, so this was all about the type 1 mechanism. The onset is seconds to minutes after the exposure. Like after the pathogen or the microorganisms that has entered the body, there is only seconds to minutes time that is taken for the activation of this process, right? So the key features that you need to remember, it is rapid in onset and are allergic symptoms involved. Okay. Examples is allergic rhinitis, asthma, anaphylaxis, that is the bee sting or the food allergy, and you have the atopic dermatitis. And you can remember that, it's a trick, you can remember that in type 1 hypersensitivity, the examples starts with letter A. Okay, just a trick to remember, although if you want you can remember the whole, but it's just a trick that all the examples in type 1 hypersensitivity starts with the letter A. Okay, so that will be very easy for you. The treatment that we have for type 1 is we can give the antihistamines and we can give the corticosteroids, and you will learn about this in your pharmacology lectures, right? So you can do one thing, whenever you are studying this section now, just read the corticosteroids part and what are the antihistamines that are there from your pharmacology textbook. Okay. Next that you have is the type 2 hypersensitivity reaction. Next that we have is the type 2 hypersensitivity reaction. Now, in the type 2 hypersensitivity reaction, what is the mechanism that is involved? It involves the IgG or the IgM antibodies and directed against the antigens on the cell surface. See, these are the toxic substances that are there. They basically targets the cells. They basically targets the cell, and there is the complement system activation that is there, as a result of which the perforins that are there, they get released. As a result of which the perforins that are there, they get released, and there is reactive oxygen species that is there, right? So the mechanism, it leads to the cell destruction. Mainly the process which it is involving is the process of cell destruction, right? How it destructs the cell? It has three mechanisms. What are they? First one is the complement activation. Second one is the antibody dependent cellular cytotoxicity, and the third one is making the bacteria tasty, like the opsonization and the phagocytosis, that is the process of eating the bacteria, right? Key features, what are the key features you have in the type 2? Is the cell lysis, that is the destruction of the cell. Then the tissue injury, that is due to the antibody attack. And the examples, if I talk, are the hemolytic anemia, immune thrombocytopenia, and the Goodpasture syndrome, right? The treatment that you will give the immunosuppressants and the plasma exchange will be there, right? See, hemolytic anemia, we will read more in details when we are discussing the hematology portion. Now, there is type 3 hypersensitivity reaction. In type 3 hypersensitivity reaction, the mechanism is immune complex, that is antigen antibody reaction is there, and it mainly involves the IgG. It involves the IgG. What it does, it forms in the circulation, deposits in the tissue, and then there is complement activation, as a result of which the process of inflammation occurs, and after that the tissues get damaged, right? This is the process. First one is there is deposition of the immune complex, then the complement system is activated. Then what will happen? There is recruitment of neutrophils, right? Then what will happen? There is immune complex plate interaction, and as a result of which the clots are formed, and lastly the tissue is damaged, right? So this is all about the type 3 hypersensitivity that we have. The key features are process of vasculitis, glomerulonephritis, arthritis, and the skin rashes. And we will study more in details when we are discussing the systemic pathology portion, right? Examples that you have, first one is the Arthur's reaction, serum sickness, and the SLE. That is nothing but the systemic lupus erythematosus, right? The treatment that you give the anti-inflammatory drug. Now, your homework is you have to read about the anti-inflammatory drugs from your pharmacology book, right? Next you have is the type 4 hypersensitivity reaction. So in the type 4, what is the mechanism that is involved? The mechanism that is involved, it is mediated by the T cells. It is mediated by the T cells rather than the antibodies. What happens is the antigen basically sensitizes the T cells and releases the cytokines. Okay, the antigen sensitizes the T cells, which releases the cytokines, right? As a result of which there is activation of the macrophages. The macrophages get activated, right? See this figure, what is happening? There is the sensitization phase is there and the effector phase is there. Two phases are there, sensitizer phase and the effector phase. In the sensitizer phase, you have the bacteria, it binds to the antigen presenting cells, as a result of which the T helper cells come into the action and they release the cytokines, right? Then you have the effector cells. In the effector cells, you have the T helper cells, the TNF-beta, and as a result of which they binds to the MHC class 2 receptor and activates the macrophages, right? Next, the key features that you have is they are involved in the process of local inflammation and the process of granuloma formation. Examples, if I talk, the examples are, first one is the contact dermatitis, tuberculin skin test, chronic transplant rejection, right? The treatments are corticosteroids. Okay. Now I have given you a table, and this table can be asked as a short note in your university exam. It can be asked as a short note in your university exams, right? So just go through this table very seriously. First, you have the immune mechanism. On the basis of that, the type 1 is IgE-mediated, type 2 is IgG or IgM-mediated, type 3 is immune complex, type 4 is T cell mediated. Time of onset, if I talk, type 1 is seconds to minutes, type 2 is hours to days, type 3 is hours to days, and type 4 is 48 to 72 hours. Okay. Effector cells that are there in type 1, you have mast cells and the basophils, type 2 complement and macrophages, type 3 complement and neutrophils, type 4 macrophages and the T cells that you have. Tissue injury, if I talk, there is in type 1 is histamine and inflammation. Tissue injury in type 2 occurs by the cells lysis and the phagocytosis. In type 3 it occurs by the immune complex deposition, and in type 4 it occurs by the cytokines induced inflammation, right? The examples, first one, all the A's that are there, right? Asthma and anaphylaxis. In type 2 you have the hemolytic anemia, type 3 you have the SLE and glomerulonephritis, and type 4 you have the contact dermatitis. So this much information is very much needed for you to understand the types of hypersensitivity reaction, right? At last, I have also given you all the key points just one day before the exams that you need to revise. What are they? Type 1, IgE-mediated, allergic reactions, all the A's. Type 2 involves the antibody which attacks on the cells. Type 3, immune complex depositions, vasculitis and organ damage. Type 4, delayed and T cell mediated. And also remember the mnemonic of acid, which helps you in remembering the types, right? So it is important. This was all about the hypersensitivity reaction that you have. Now it's time for us to solve some MCQs, right? First one, there is a 24-year-old man, okay. He presents with sudden onset of shortness of breath, okay, wheezing and swelling of lips. Okay, as of now, I don't think so I have got any hint or come to a conclusion, right? Now, let's read forward. And faces after eating a peanut. Okay. Now, they have given a very important history which you need to focus upon. That is, these all events are occurring after he eat a peanut, right? So, this can be a allergic. This can be due to the allergy. Maybe the person is allergic to that. Maybe the person is very much allergic. So the allergy one is involved in the type 1, type 2, type 3 or type 4, which it is involved? It is involved in the type 1. Allergies are involved in the type 1, that is the immediate hypersensitivity. Next question. There is a patient with Graves' disease. Okay, they have given a very important clue. Graves' disease, right? Has autoantibodies that mimics the thyroid stimulating hormone. Leading to the hyperthyroidism. So which type of hypersensitivity reaction it is? It is the type 2 hypersensitivity reaction. It is the type 2 hypersensitivity reactions. And now we are over with the hypersensitivity reaction part. Okay.